The coronavirus pandemic challenges us like never before, but in every crisis lies great opportunity. Amid this profound disruption and uncertainty, professionals in health continue to tackle unique problems with resilience. We continue to adapt, turning obstacles into the catalyst needed for transformation. From the delivery of care to addressing health equity and providing support for critical community needs, we are rethinking processes and implementing creative solutions at an accelerated pace. Today, we come together to share diverse perspectives and bold ideas, to learn, innovate, and strategize for a new era, to inspire a positive change in purpose for health.
On behalf of Priority Health, we are proud to serve as this year's presenting sponsor. Healthology aligns with our unwavering mission to improve health, inspire hope, and save lives because we believe all people deserve access to quality, affordable care. We know that real change is possible through teamwork with community partners across our state to achieve better health, and especially among the most vulnerable populations. We are pleased to introduce this year's program, which focuses on navigating a new reality beyond COVID-19 and implementing innovative solutions in health moving forward.
Good evening. We are pleased you are joining us. While we would have certainly wanted to get together in person, the ongoing public health crisis has created challenges, but also offers new opportunities. And so we are joining you today through this virtual method. This is as important a moment as ever to come together, especially during this unprecedented time in our history. I am both humbled and honored to be a part of the Oakland University School of Health Sciences, which provides an engaging and inclusive environment of collaborative, academic, and clinical learning to over 2,000 undergraduate, master's, doctoral, and post-professional students. Every day, our dedicated faculty and staff empower students to confront health challenges, improve patient outcomes, research global crises, and collaborate with community partners to lead change. Healthology is one example of the collaborative learning methods we value in our school, enabling students and faculty to make meaningful connections with our community to improve the lives of those we serve across our campus and beyond. Now, it is my distinct privilege to introduce the president of Oakland University, Dr. Ora Hirsch-Peskovitz. As a renowned physician and researcher with more than 30 years of experience leading change in academic health centers and universities, she is a champion for higher education, healthcare, diversity, and women's issues. Our university community is truly fortunate to have her leadership, as she is committed to ensuring all students have the opportunity to live, learn, and thrive in a safe and welcoming learning environment.
Thank you, Kevin, for that wonderful introduction. And thank you for being such an ardent advocate for improved health for all people and for all communities. And of course, for your great work leading our School of Health Sciences and for transforming our students into leaders. And welcome to Healthology, a virtual symposium where science, practice, and social interests meet, and where we can ignite innovation in health. And welcome to Oakland University. We know that you're attending this symposium with a sense of purpose, and we hope that you will leave with a sense of momentum and a renewed commitment to join us in effecting positive change. Now, more than ever, those of us who are dedicated to positive steps toward vibrant health for all people and all communities must think and act innovatively. And this means addressing upstream social determinants of health to achieve better downstream care. We meet virtually at a time of the greatest public health threat in our nation's and our world history. During this crisis, I have been so appreciative of the courage, determination, and hard work of frontline health professionals who have taken on the challenge of protecting all of us during this global pandemic. The deadly COVID virus has upended all facets of our lives and has exacerbated health inequities, revealing a lack of fairness and preparedness. Many of you are dealing daily with these stark realities, and I look forward to hearing the stories of creative problem solving, fortitude, and how you have turned challenges into opportunities. Clearly, we must have a coherent and strategic national approach to address the virus spread. Yet, we must be equally committed to identifying the people and the communities that are being most impacted. Through collaboration, we can design and implement solutions to bring about greater public good. While there's uncertainty about the future, we must continue to engage in conversations that connect theory to best practices in purpose for health. Together, each of you who are here today at Healthology represents collective and relentless determination. And I have no doubt that the sharing of our expertise and best practice stories will itself provide encouragement and inspire us to be ever more resilient and more resourceful. Thank you.
Thank you, Dr. Peskovitz. Our program would not be possible without the generous support of our sponsors. We are especially grateful to Priority Health for serving as this year's presenting sponsor. Continued partnerships foster our long-standing tradition of celebrating impactful research with community engagement that affects health outcomes, ultimately creating educational opportunities for our students who become future leaders in health. I am honored to introduce one of those leaders to you now. Samantha Carson earned both her undergraduate and graduate degrees from the School of Health Sciences. She is a member of the 2017 Master of Public Health class. Samantha is a practice coach and quality improvement strategist at MedNet One Health Solutions. She is one of several high-performing graduates of the Master of Public Health program, leading multiple initiatives at MedNet One Health Solutions. This organization has played a key role in the formation and ongoing support of our Healthology series.
Thank you, Dean Ball. As a student, I learned the importance of impacting the health needs of our communities through diverse wellness and health-related practices. Every day, I apply the skills I gained in my career as a health professional. MedNet One Health Solutions is proud to sponsor Healthology 2020. It gives me great pleasure to introduce my mentor, Eva Matuszewski, CEO and co-founder of MedNet One Health Solutions, and a chair of the Oakland University School of Health Sciences Board of Advocacy and Resource Development.
Samantha, thank you for that introduction. In Purpose for Health. This virtual gathering today is an affirmation of our collective commitment to the foundational purpose of Healthology, sharing industry best practices to cultivate a community culture that drives upstream population health. On behalf of the Board of Advocacy and Resource Development, I thank you for your participation. My fellow board members and I are honored to support and advocate for the school's programs, activities, and related educational experiences for students and professionals. By engaging business and community leaders and utilizing our extended networks, the board aims to increase the school's visibility, foster partnerships, and expand opportunities for students, faculty, and alumni. We support transformative, interprofessional learning and innovative outcomes, and work collaboratively to build on the already strong reputation of the School of Health Sciences.
Thank you, Eva. We are extremely grateful for your leadership and for the unwavering support of our entire board, many of whom you will hear from this evening. These knowledgeable and dedicated individuals graciously volunteer their time and energy to help advance our school's mission. They are engaged, effective advocates, and we greatly appreciate their insight, guidance, and expertise. And now, I am pleased to present this year's dynamic program, which showcases compelling stories of a diverse group of health leaders through a series of interviews. So let's start by describing how COVID-19 affected the delivery of services to your stakeholders and to the people you serve. Take us back to March. What was going through your mind?
COVID-19 had a profound impact on our stakeholders and our delivery system. I watched news reports in the Johns Hopkins tracker for the novel coronavirus, and all of the cases were over there. They were in China. It was Italy that was on fire. Then it became the Pacific Northwest. And then on the evening news, we watched the map of the U.S. states begin to turn red and creep towards Michigan. This was something very different from the Ebola virus that we had prepared for, but really only had a few cases. We needed to detect a new virus that we had not seen before, and we were confident we could do it. But the FDA would not allow laboratories to develop their own test. We had to use a CDC-developed test, which was having problems at the time. And on February 29th, FDA lifted the ban, and 15 days later, we had a test. It's now Monday, March 16th, and at Henry Ford Hospital, we launched the first test for SARS-CoV-2, the coronavirus which causes COVID-19 disease. It's a laborious, multi-step DNA, RNA test, and we can only perform 288 a day, and we knew that we would soon need to be able to perform thousands and possibly millions of tests. With these capacity limits, we had no choice but to prioritize and test inpatients, emergency department patients, healthcare workers to get them back online, and first responders.
Oh, mid-March, when I heard the word COVID, I didn't realize that it was the beginning of a nightmare for healthcare and society. The pandemic, when it hit, really upended all of our services at the hospital. The governor had an order that our OR was basically shut down for elective services for the safety of the patients and the staff. Our OR nurses had to be redeployed to the ICU because the ICU filled up with ventilators and COVID-positive patients. We had to reallocate staff to our general med surg unit and create a COVID unit. Our ER, we had to have tents because people were coming in droves for screening. We couldn't handle them in our regular OR physical space. It was chaos, and we had to take that chaos and try to see how we could organize it.
One of the biggest challenges that we had to do was to close all of the ambulatory rehab clinics within the Bowman system. Another challenge that we had to do was the increased influx of patients that had COVID and the need for us to reassess the environment and submit to all of the new regulations from the CDC and, of course, the infection control regulations that we have within our hospital. These two areas were very significantly affected the operations of the department.
So March 2020 came at us, and we were watching what was going on overseas and paying very close attention. I was leading facility management for General Motors at the time, and as we were observant, we realized that this was going to move a lot faster than we expected. We were seeing how our counterparts in China were dealing with the impact of the pandemic, and we quickly started marshaling resources to figure out what we needed to do. From our perspective, our install base in North America is much larger than what we have in China. And so we had many facilities to consider, and more importantly, many, many people. And the number one priority was, how do we keep people safe? And what we did was we worked on communication. When we were going to tell people to go home or ask people to continue to working at work, we had to make sure that we were doing that well. And then we focused on the right processes, the right knowledge from CDC and others, and really depended on the experts to make the best decisions so that we could increase our cleaning capabilities and things like that, with the number one intention to keep people safe and make sure they understood why we were having to do such drastic things with their lives.
So for the UAW Retiree Medical Benefits Trust, our first concern was to ensure our 620,000 members across the country had access to timely and needed health care. Our members, of whom 83% are over the age of 65, are considered high risk for COVID-19, just based on age alone. At the onset of COVID, our members were immediately impacted. Their regular care was disrupted. We were concerned about access to emergency care. Therefore, we were challenged to find new avenues of information for our members to secure access to care, especially for our most vulnerable members, notably those, for example, in the middle of a care cycle, such as a scheduled surgery or an upcoming chemotherapy treatment.
What an unbelievable period of time we went through. March the 15th, the Ides of March, the day Julius Caesar was killed. And now we are facing a pandemic that we thought was going to end in a very short period of time. That very next day, we had to shut down our own company. Staff was told they would be working from home, and we started calling our physicians, 900 of them, to find out what they needed, what support we could provide them with. And we discovered very quickly they did not have sufficient PPE. They did not have sufficient funding to actually pay for their payroll that week. Many of them were in a situation where they didn't have money for their own leases. They had vehicles they had to pay for, and suddenly they were left with nothing. So it was up to organizations like ours to make sure that they did have sufficient funding and sufficient support for the next few weeks.
I think about when I woke up on March 16th and I was informed that my studio was going to have to be closed. And I knew at that point that business was not going to be the same and that I was going to have to close the doors. But what I did not want to do was close the doors to the programs and offerings that I provided my clients. So within a couple days, I had already sent emails to all my clients with very detailed information on how we were going to continue with providing the programs and services online. I also provide a very detailed list of discounted equipment that they could purchase so that they continue their exercise programming at home. And then I also contacted my mental health clients and my nutrition coaching clients and let them know that we would continue. It was just going to be done virtually, and that I was going to be there to support them and provide them the continued service and quality of service they expected.
Immediately, it was a very unusual time, very disruptive, because people were not getting the care that they needed to get. So their health care was really important to us. They were not getting any services. They couldn't go to hospitals, they couldn't go to doctors' offices, which was a complete disruption for our business. So immediately we tried to figure out what could we do to sort of circumvent those issues. And one of the issues that came up right away was that we could offer virtual visits. And so we started to move toward offering free virtual visits right away for our members so that they could get access to health care when they needed it, because then we knew they weren't going physically into places to get it done. So we were trying to support our providers by doing that, our members. We sent our team members home, our personal employees home, and had them work from home so that they were safe too.
Our clinic is a outpatient orthopedic, physical, and occupational therapy clinic. On a given day, we see up to 130 patients and can have up to 20 employees working in one office. So when March came, we really didn't understand COVID, and our first thing was, how do we keep our patients safe? How do we give them effective care? How do we keep our staff safe? A lot of anxiety was going on. So we quickly started brainstorming on how can we do social distancing, how to keep our clinic safe, how to keep our patients coming in and understanding the signs and symptoms of COVID and how to keep everyone calm.
Around March 12th, I woke up, and as the pandemic scenario was unfolding, it was certainly a riveting moment where I had to assess the situation with my colleagues at First Group of America, a transportation services company. And my immediate thought and reaction is, how are we going to safely transport the tens of thousands of student passengers on a daily basis within the school districts that we serve? So my immediate reaction is, what is the team that I had to engage, the colleagues, because we interface with the public. We operate in almost every state in the U.S. and every province in Canada. So it was really just assessing the situation and think about our ultimate customers, our student passengers, and really how we was going to address this unfolding situation.
As a department chair at Oakland University, I was able to see how the university responded to the coronavirus pandemic from multiple levels. First and foremost, we were concerned about keeping everybody safe on campus. And so Oakland University moved very quickly to close campus and move to an online format. In health sciences, we have students that are in clinical placements within the physical therapy program. We've got students in our clinical and diagnostic sciences program who are in labs every day that are working side by side, looking in microscopes and analyzing specimens. And then we have students who were just used to that face-to-face class format. And so we saw very quickly students and our faculty having to shift into entirely new delivery models.
So a few weeks have gone by. It's April. How did you adapt and respond to the challenges?
McLaren Pontiac, or McLaren Oakland, responded very quickly to the challenges. It's interesting because our corporate offices were not responding as quickly and nimbly as we were. So almost sometimes there was a rub in terms of which policies to follow. But we were trying to put our patients and our staff first. And we, through Oakland County, were able to get personal protection equipment, masks, and gowns and so on that our other McLaren sister hospitals were not. We were also very fortunate that Ford, GM, and other donors were bringing masks, were bringing gowns. I remember actually getting a call from St. Joe, Oakland, which is a competitor, and they were out of PPE, so I drove boxes over to them because at that time we were trying to really get to a normalcy of how we're going to create a structure to fight the crisis of COVID.
Information changed so fast that we had 6 conference calls per day, 7 days a week. Some of those conference calls had over 400 online. Every day seemed like a Monday. Personal protective equipment is in very short supply. We wanted to put masks on all patients and staff, but if we did, we would run out of masks in 2 days. The blood supply was also falling dangerously short because of the stay-at-home order and people were not out donating blood. 5 days later, we heard the announcement that our health system was at maximum inpatient capacity. We worked with the Army National Guard to convert TCF Arena, the former Coble Hall, into a 250 to 1,000 bed field hospital. For our laboratories, the arena was a temporary extension of Henry Ford Hospital. We went on to close outpatient clinics, suspended elective surgeries, and furloughed 2,800 staff. This would preserve personal protective equipment and reduce crowding in waiting areas. Hospitals are usually a mix of medical and surgical spaces, and we converted nearly all to medical. We were one giant ICU. On April 3rd, with over 400 on a conference call, we heard our first bit of good news. Today, we've taken more patients off ventilators than we put on ventilators. A hospital president called me to say, "John, your testing has made a world of difference. We can now get patients on the right drugs for patients within 24 hours. And she was talking about remdesivir, anti-interleukin-6, hydroxychloroquine, and steroids. All of our tests were completed in less than 1 day, most under 12 hours. And with every discharge from the hospital, they played the Journey song, "Don't Stop Believing," over the intercom. I made a decision to double test 80 Army National Guard members assigned to TCF Arena so they did not have to undergo a 14-day quarantine. That turned out to be a good decision because 10 days later the dams broke in Midland and Sanford Lake, and the National Guard had to go in there and lend a hand.
We had to adapt very quickly to these new challenges within our departments. For example, in the ambulatory side, we had over 300 therapists that we needed to now move from their traditional roles into new functions and new roles either within the department or within the hospital. In the acute care area, we also needed to retrain some of our therapists that were accustomed to treating patients who were free from COVID to now patients that were infected with COVID. So that was a very important role for the educators within the departments who had to develop new training material to teach therapists that were coming from the ambulatory side and also to teach the therapists that were treating in acute care new ways of treatments.
So to adapt, we started different tiers. We started a telehealth tier for patients where we got them into therapy electronically, virtually. We had a track of where patients were still able to come into the clinic, and so we had to have protocols on social distancing, how cleaning policies, as well as educating our patients when they should and should not come into the clinic. We had to rethink how we delivered our care.
How we adapted and responded to these challenges at First Group is that we had to ensure that we properly educated our workforce. In particular, our professional operators, our drivers. We had to look at that population being an at-risk population because over 2/3 of our drivers are in that at-risk category, 60 years and over. So we had to really evaluate and reassure them based upon the data, the best practices of the CDC, the World Health Organization, that we was going to ensure their safety and well-being as professional operators. And additionally, we also had to ensure that the safety of our student passengers. We had to work closely with our school districts. So we assembled a cross-functional team to evaluate every possible scenario and then develop those appropriate standard operating procedures.
This public health crisis exposed and exacerbated healthcare inequities and a lack of local preparedness. Please tell us about that.
So within a very short period of time, we discovered that the local health departments were really ill-prepared to support physician groups and to even support the community. And if you pushed it even further, health systems were really ill-prepared to assist the smaller physician community and the patient population. So what we needed to do is step up to the plate to figure out ways in which to support not just the physicians, but also to support those that may have been at risk and were not able to receive the type of support that they needed. Perfect example was when we began receiving lab feeds identifying individuals that were positive COVID, and we would reach out to them only to discover that in many instances they didn't have food or they didn't have medication. They were unable to go ahead and treat their own family appropriately. So we began sending packages to them with diapers, with pulse oximeters, with hand sanitizer and PPE, and that continues to this day.
The inequities in healthcare existed well before the COVID crisis, but I think what it did was it really exposed the inability for our system to handle any healthcare crisis like this. The very fragile network that we did have wasn't sufficient for a crisis like this. One of the things that we noticed right away was an increase in behavioral health needs due to the social isolation and the crisis that was happening and all the social factors that go with it. Behavioral health became a major issue. So we've seen behavioral health claims go way up, services go way up. We started to offer free behavioral health visits virtually so that we could provide that need. And that's something we wanted to do right away. It doesn't address all the needs, but it addressed that one really important one right away.
So I work in outpatient orthopedic physical therapy, but my specialization is in women's health, pelvic floor, and working with women with pre and postnatal care. And during the pandemic, or in March, a lot of those patients who were pregnant or just recently had a baby, they were too left behind. And they were scooted out of the hospitals, and they were discharged home, and in many cases they were isolated and had very little resources. And in our practice, we were able to bridge that gap by offering telehealth services and being able to connect with these patients and provide the health care that they needed and answer their questions and help them with their isolations that they were feeling.
What we saw from a local perspective was an issue for everybody to stay home and stay safe to prevent the spread of coronavirus, because we didn't quite know how it was spread from person to person, and that was our best case scenario to slow the spread and keep people safe. But for low-income members of our community, that was impossible when they were trying to feed their families. They're relying on fragmented emergency food systems that are full of rules and eligibility and just really impossible schedules to keep straight. And so what we saw on the ground was families having to go to multiple locations just to make sure their family had an adequate diet. The first thing that we see when somebody loses their job and as soon as schools shut down is they don't have enough resources to purchase food. And so they end up going to a local food bank where they might get 3 or 4 days worth of food. They have to visit the local school systems, which really responded quickly to try to get kids fed. But oftentimes we're requiring families to go there 3 or 4 or even 5 days a week to get a couple of meals for their kids, and it still wasn't enough, forcing our most vulnerable populations still to go to the grocery store, use their limited resources, and put themselves at risk for coronavirus exposure. So while we're telling everybody to stay home and stay safe, they're going out 5 or 6 times a week to try to just meet their nutritional needs.
What opportunities arose as a result of this pandemic?
What was really interesting a couple months into the pandemic is I noticed that the obstacles that I had with the physical location I no longer had virtually. So clients that would have difficulty getting to the studio, work related, not being able to get to the studio after work due to traffic, not having to deal with the stress of traffic. Also, the cost that was associated with traveling to the studio had essentially been eliminated. So what I found was that the people that I was providing services to, they were relaxed, even though we were in stressful times. And so that was really great. I also was able to cater to people outside of my normal demographic radius. So I was able to extend my services to people that did not live in close proximity to the studio. In fact, I was training a client in Mexico and Texas, different locations like that. So definitely opportunities arose out of chaos.
Regarding prescriptions, we moved quickly to improve access to medications through a prescription drug readiness plan. Throughout COVID and in more than 16 states where we had declared areas of emergency, we relaxed requirements to access prescriptions when members were not able to connect with their physicians for renewals. We monitored requests for drugs that were in the news, hydroxychloroquine, asthma medications, and azithromycin, to name a few. We wanted to ensure that members who needed those medications were able to get them, but we also wanted to keep national supplies in check. We noted an increase in the use of mail order services. We know that mail is a safe way for members to access their medicines and can improve long-term medication compliance. We updated our communications and we provide direct assistance to members to help make it easier for them to use mail refill services. We improved access to telehealth services across the country and now have made it a permanent benefit. Throughout COVID-19, we saw a dramatic increase in the use of telehealth services as a safe alternative to traditional care.
As we were leading through the pandemic, all of us were adjusting, particularly as leaders in a very large organization. We were trying to figure out how to lead well. And one of the biggest opportunities that arose was for us to improve our ability to lead with empathy. And as a large manufacturing company at General Motors, we do lead with empathy, but this was another level of empathy and another level of understanding, seeking to understand how the decisions we were making were impacting all of the individuals in our spectrum of responsibility. And given the different responsibilities that individuals have, we had to think differently about what people need, not only from a technical professional level, but from a personal level. We really had to pay attention and make sure our solutions were innovative enough to get us there. And from that, we realized that we had more disparity in the way we were relating to people in leadership than we were comfortable with. And out of that, partly was born my new position, which is the Chief of Diversity, Equity, and Inclusion for the company, where we have absolutely ramped up our efforts to lead with empathy across the organization.
There were several opportunities that arose at First Group of America. After we implemented our strategies and standard operating procedures, we did learn that as an organization that we had a great opportunity to leverage preventative health measures and look at strategies where we could partner with healthcare providers and even our insurance providers to have a strategic approach to work-life balance, as well as the best health measures for our workforce. So we looked at corporate initiatives that we convey to our workforce to really reassure them once again that it's best to be preventative as opposed to, as we say, hierarchy controls and safety and health, to wear your mask and practice social distancing, which is very important. But if we can get ahead of the curve and practice sound preventative health measures, that we're taking a more proactive approach for our workforce, for our employees.
How will you and your organization implement innovative solutions moving forward?
It's great to be at a point right now where we can look forward from COVID-19. Even though we're still in the middle of the pandemic, what we're realizing is that there is a future in front of us, and that the future looks a lot more flexible than the past that we were living in. We're focused on flexibility of life for employees that are inside of the company when they're at work, but also when they're at home. We have a lot of people working at home, and so we're innovating new solutions. We're helping them figure out how to keep themselves healthy at home. We're integrating health and well-being in all of the considerations we're making going forward, much more than we ever have in the past. We're looking at upstream care for those that are working at work, making sure we focus on their upstream care and their ability to give themselves assistance up front and early from a medical perspective. And that is really exciting for us as leaders to consider, along with the technical innovations we've seen coming out of COVID-19, and making sure that those stick in terms of how to handle people's technical needs on an ongoing basis and being more agile.
We have to be able to assume many different roles within our organization, including those that are outside our own traditional rehab setting. Including, for example, we might have to develop therapists that are only doing virtual telehealth, or developing the materials to teach and train patients, as well as teams that can direct care at the patient's home.
So looking at the first wave of COVID taught us many lessons. And so we took the summer to plan and to do, just as if you have a disaster, you do disaster preparedness. And really that's what we're doing. We have teams that are focused on, for instance, our OR nurses going up to the ICU. They didn't even know how to chart on the EMR because it was just different. They hadn't been on an inpatient unit for years. So looking at how do you redeploy staff in an effective manner? How do you do on-the-job training? What types of equipment do you need, and where are they on the unit? This created a chance for us to do process improvement, to really look at equipment deployment, and to look at human resources and what we need, when we need it, at a very critical time. I think if COVID comes back, as it did, I think we'll be so much better prepared and the staff will be more knowledgeable.
COVID-19 has certainly accelerated the need for more intense care that can be delivered at home. Care for conditions such as acute exacerbations of chronic lung disease, congestive heart failure, or even a course of intravenous antibiotics. Care that previously would have required a trip to the emergency room or even a hospitalization can now be done safely and effectively in a home setting. We are ready to help our members gain access to COVID-19 vaccines and treatments as soon as they are approved and available. And we continue to promote the use of mail-order prescriptions as a safe and cost-effective way for members to stay on track with their medications. Finally, we are evaluating solutions to keep members connected with family, friends, and caregivers. Throughout this crisis, we have seen how important these connections are to help our members address the social isolation and mental health needs that COVID-19 pandemic has certainly intensified.
The Body Principle will continue to provide mental, nutritional, and physical health services to clients online, and then we will do it in person when it is deemed safe to do so. And any adjustments that need to be made as situations arise, we will adjust accordingly. The great thing is that we see that we don't have to stop providing those services and offerings. Another thing that's been really great is I've done a radio show for several years called Empowered that airs on 9 to 10 a.m. Superstation every Sunday from 1 to 3 p.m. That has been a wonderful platform because not only was I able to interview medical professionals during the COVID-19 pandemic that provided education as well as resources that was beneficial to people through the COVID-19 pandemic, I now am able to continue to interview medical professionals, wellness professionals, physical health professionals that allow me to provide resources as well as support to help people continue to be safe and healthy through the COVID pandemic and beyond.
With regard to COVID testing, we understood that the international supply chain was disrupted and really broken, and we were all competing for the same available supplies. We did better than most because we developed 5 different testing methods on 17 different test platforms. We continued to test in under 24 hours compared to commercial labs, which take 4 to 14 days, and you can't do contact tracing when it takes that long to get a lab report back. Many of the rapid methods that you've heard about have problems with 20% false negative results, and we've heard about these problems. So now we test hotspots which flare up in nursing homes and with first responders, and in communities. We work with businesses, 6 universities, including Oakland University. We work with college and professional sports teams and some local school districts. So through it all, we've learned a lot. We've accomplished a great deal, and we have a playbook for going forward. We can test thousands of samples a day. We're confident, but we're still concerned. This virus is still out there, and influenza season is upon us.
So from an educational perspective, Oakland University has done a number of things to make sure that a high-quality education remains accessible to the student population. We have seen a lot of our classes go into an online or a hybrid format. Some of our classes are offered synchronously, so you can be talking with your professors and your classmates in a virtual room at the same time. But we know that that model also doesn't work for everybody, especially when they have job and caretaking responsibilities. And so there are asynchronous opportunities available as well. We've also been able to implement the highest public health protocols to make sure that as students are returning to campus, that they're being kept safe. Our classrooms are down to a reduced capacity, and we've used our biggest rooms available on campus for those classes that still do benefit from meeting face-to-face. And then we've implemented safety precautions in our labs to make sure students can stay at least 6 feet apart. We've also seen them go back into clinical settings in a very safe manner, and then we've also seen some scheduling changes with some of the physical therapy practicals where students need to be able to demonstrate certain skills. And so the innovative approaches have allowed Oakland University to continue successfully providing a high-quality education. One of the unexpected opportunities that we've seen as a result of the coronavirus pandemic was the opportunity for students to engage in service learning with real-world projects happening in the community. In Oakland County, the My COVID Response Network was able to bring together over 70 partnering organizations to work to deliver food to the community together. And so we were able to streamline delivery and increase the number of families served so that we are providing direct delivery to the most vulnerable populations of food and supplies to about 1,000 households per week. And that is something that has not been achieved by any other organization in the local community. And so this collaborative network response to the infectious disease pandemic can serve as a national model for other organizations looking for how to bring the community together to respond and just achieve increased efficiency and customer satisfaction. And so we're just thrilled that students have been able to take advantage of that educational opportunity, completing practicums and independent research projects with our organization.
We've enjoyed working with each of our participants in putting together this presentation. And of course, we thank our generous sponsors for their support and partnership in making an important difference in the lives of our students and faculty, both educationally and by reaching communities to create impact. For further conversation, let us now turn to our virtual networking chat rooms. To join, please open your browser and visit www.oakland.edu/shs/community/healthology. If you are interested in supporting Healthology and the School of Health Sciences, please click on the Support Our Work button. Finally, I thank each of you for attending today's program. Your participation is helping us lead the way toward better upstream health and better downstream care in our schools, communities, and in our world. Thank you for joining us in Purpose for Health.